All right. Well, welcome everybody. I don't see your faces, so it feels weird to be talking to the masses. Thank you so much for joining us at Lipedema Canada. I am Angel. I just wanted to give a big thank you to our board of directors who are all present here for the work that has gone into compiling all this information and translating it, and especially Emma, who was up at 4 a.m. last week to watch the live stream of this happening and translating it. And it's a lot of information and a lot of medical information, which is, yeah, it's a lot to process. And we're so appreciative of everything that has happened on this board in the last week. And I am going to turn it over to Emma now, who's going to start, and then let your questions flow in the chat and we will respond to them. Take it away.
Thanks, Angel. Alrighty. I'm just looking on why our screen is doing what our screen is doing. Let me just pin. Sorry, guys. Spotlight for everyone. Hi there. I don't know what was happening. I don't work here. Hi, everybody. My name is Emma Cloney, and I am the resident nurse here at Lipedema Canada and the lead for our medical stuff. And I am also very tired, but very excited to come and talk to you. Just a couple of quick housekeeping things. We do have directors here with us right now who are bilingual. So both Holly and Helen are here for our group from Lipoedème Canada, en français. There is a caption button. If you look over your Zoom at the bottom, if you need what we're talking about to be translated, please turn on your closed captioning now so that that will happen for you in French if that is what you require. I know everybody is here because we need to talk about LipLeg and we need to understand what that is. And so the game plan here is that I'm going to open up some documents and we're going to walk through it together as a team. But here's the short version. The shortest version is this. Many of us have questioned why it is so hard to get access to healthcare in Canada for lipedema, whether that's access to a diagnosis, access to coverage for your conservative treatments such as your compression or your MLD. And a big topic in our community is access to surgery. And as you know, some people in Canada have been covered, but it's usually after a lengthy legal battle, and it's never been a simple process, and it's not presently standard insured. There's a lot of reasons for that. Let's go through the quick barriers for Canadians when it comes to lipedema. Number one, lipedema, while it is a recognized health condition since 1940, it is not recognized properly in Canada. So what do I mean? It is not currently taught as a standard inclusion in any Canadian medical school. That means that they don't learn it in medical school and they're not tested on it in exams. That's the main reason why it's so hard for you to find care. As a result, there's no specialists for lipedema in Canada. We don't have a Canadian standard of care, which is a series of rules and guidelines, policies that are set out about what is the diagnostic criteria, who can diagnose, what's required to diagnose, and then what treatments do we offer. There are international standards, but we don't have one. We do have a diagnostic code recognized by the World Health Organization. Unfortunately, it's not integrated into the provincial healthcare system in any Canadian province because it uses a new version, and no surprise, we're using an old version. And there isn't qualified specialists for lipedema in Canada for surgery at all. And we are going to talk about concretely evidence-based why that is and what does this thing that happened in Germany mean for us. So the short answer is this. On July 17th, last week, the German Joint Federal Commission, which is basically like their Canada Health, if all healthcare was mandated right at the top, they got together to meet on a study that had been in progress for 5 years, a very important study called LipLeg. LipLeg's job was to look at the effectiveness of lipedema reduction surgery in all stages of patients as compared to just using compression and MLD for management. What we have been lacking in the lipedema community until last week was any gold standard evidence that shows that lipedema surgery is effective or not effective, safe or not safe. We just didn't have the data. And that's been the linchpin in the coverage issues, not just in Canada, but in almost every place that has socialized medicine around the world. So we're going to get into what LipLeg said and what this decision means for us. And then at the end, we have an action plan and there's things that you can do immediately following this meeting. Okay? put your questions in the chat. We're going to do our best to get to them. I hope this will be comprehensive enough to get through it all. Let's start with the documents.
Wait just a second, Emma, just for everybody's sake, this is being recorded, so don't worry about it. It will be recorded and made available after our session.
Perfect. Thank you so much. Okay, let's go here. So I've got the decision document. Folks at home, friends, and Lipedema Canada, can you guys read that okay? Is that large enough? Everyone can see? Okay.
Yeah.
So Lipedema Canada has translated all of these documents from German to both English and French for you. And yes, they are available, and we'll make them available to you immediately after the meeting. So this was the decision document. Basically, the Joint Federal Commission amends its hospital treatment policy related to liposuction for lipedema. We're going to go through the highlights. Now, the GBA, that's the acronym we're going to use for the Joint Federal Commission, they had a job to make one of three decisions. The ones that are highlighted, they needed to decide either that the surgery is going to be an insured service, meaning that it met the gold standard criteria to be included under the public healthcare system. The second option they would have had, which is right here, is to determine that there would have been benefits to the treatment, but that maybe we hadn't sufficiently proven those benefits yet. That would be, as we understand it in Canada, to be the emerging criteria. That is what Canada currently has lipedema surgery listed as, is emerging. And then the last option they could have said was they would have said that there was no offer of potential help from this treatment, and then it would be classified back into experimental, or in the German case, it might have just meant that no one was allowed to engage with this treatment at all because it wasn't safe. So for short order, insured, emerging, experimental. That's the Canadian context. Let's roll. Now, on February 10th, 2025, the early results from the LipLeg study, which was a long-form study over a 5-year period of time, which included over 400 participants with stages 1 through 3 of lipedema, all of which who had been confirmed by 2 separate doctors independently that they did in fact have lipedema, participated in a randomized control trial where it was investigator blind. So there was a group that was going to receive surgery and a group that was not initially going to receive surgery. And all of their wounds were covered with little plaster bandages so that the researchers wouldn't know who had had surgery and who wouldn't. And that's how they made sure that they stayed separate. They followed this group over a series of 4 surgeries and assessed them the whole way through. The primary objective was to look at what does the surgery do to the primary symptom of lipedema, which is pain. So in February, those results were turned in to the GBA, the German council there, and they had to evaluate them. The end results are going to come 1 year from now, which will be after they've looked at everyone who's had surgery over that full 24 months since their final surgery. But the results at just 12 months were so compelling that this went to the GBA in order for them to make a decision because the results were so clear. All right. So previously, liposuction for lipedema was only being covered for stage 3 patients in Germany, and only as it applied to medical necessity. They weren't including it for anybody else, and they had some strict criteria around it. Okay, so I've highlighted this. According to the German guideline, the S2K guideline, which you've probably heard me talk about before, lipedema is described as a painful, disproportionate, symmetrical fat distribution, which affects the extremities and spares the hands and feet. The part I wanted to highlight here is pain is the main symptom of lipedema. And therefore, that's what this study was looking at. For your interest, they did classify the 3 stages, and we know them to be as we've known them to be based on how big the limb becomes. But the important thing to note here, the German guideline is very clear, and so is the study, that the staging of the size of your body is not reflective of the severity of the disease. What that means is that people who live in a stage 1 body can experience massive amounts of pain and dysfunction. And sometimes people living in much larger bodies are not experiencing as much pain, but it's reflective on that particular patient, and it's not based on the size of your limb. Okay, So they do talk about what the method of liposuction is, and you guys can go and read that. We're going to keep moving through the real important stuff here, and I promise if you love reading science stuff, you're going to love this paper. So like I mentioned, if you're looking for results of the LipLeg study, they are actually in this document, and I'm going to help pull some of that out for you right now. So like I mentioned, LipLeg was a randomized control investigator blind multi-center, which means it didn't just happen in one place. These results were replicated in multiple facilities across Germany. That's really, really important when it comes to research, that the same results are occurring in multiple places so that it's not showing a bias. This is part of what gave the study its evidence. So we had 410 participants. We were looking at female patients over the age of 18 with confirmed lipedema. And the primary endpoint of this study was we were looking to see if lipedema surgery was going to reduce pain in the legs. For the purposes of this study, they only did surgery on the legs. They have now decided to cover surgery for the arms and the legs, but the study only does legs, okay? All right, they looked at a whole bunch of other secondary endpoints, including improvements to quality of life, improvements to mobility, decreased mental dysfunction, all of the things that we express to the researchers all the time about how hard it is to live with lipedema. They evaluated the majority of those as secondary criteria. Okay, important things to note. The study concluded that the maximum amount of liters that can be removed from a patient's body during a lipedema liposuction procedure is the equivalent to 10% of the patient's body weight. Why is that significant? In Canada, we only offer cosmetic liposuction here because we don't have any provisions made for lipedema. And the national maximum that is allowed is 5 liters. This is a not negotiable rule. It's determined by policy. So we need Canada to adopt a policy that recognizes and understands that we need different liter limits until such time we need to go where treatment is safely available. Okay. Lots more details on the study, cool buttony looking things. I'll let you read this for science. Let's get to the good stuff. So what did the study ultimately show? Well, this was really important. At the end of the study, at the 12-month mark, in the group that had liposuction, 68.3% of those patients achieved the primary endpoint, which was a reduction in pain, a significant reduction in pain. Whereas the group that just had engaged with conservative therapies, being compression, MLD, etc., only 7.6% of them had a reduction in pain. So that being the primary objective of the study, this is great news. But there's more. As far as movement limitation was concerned, there was a clinically significant, which means A+, we did it, clinically significant improvement in 70% of the patients who received liposuction for lipedema, as compared to only 10% in the conservative measures group. This was confirmed across all stages, as was the result before it, doing away with the supposition that it's hopeless to treat advanced cases or that we should really only be treating advanced cases because the early stages aren't benefiting. That is not what the study showed. The study showed practically evenly, and I'll show you those results. Have a look. Here's the numbers for pain, okay? The 68.3%. Well, this is our stage 1 group. 67% of them said they had improved pain. In stage 2 was 72%, and in stage 3, 64%. Those numbers are great. They're very much on par with each other. There wasn't a wide gap. So that's really, really relevant to us. Back up to here. When we talk about the mental health effects of lipedema, they evaluated that on a scale here, and they found that there was a clinically relevant, again, A+, we proved it, there was a clinically relevant reduction in depressive patients for those that had liposuction versus those that didn't. So 36.7% of patients who had the liposuction had an improvement in their mental health, whereas only 5% in the control arm. You guys feel like scientists yet? Here we go. All right. Now, quality of life is an enormous issue for lipedema, okay? We all know that. We've been screaming that from the rooftops. We actually were able to put some stats, some real hard data on quality of life. So they did a variety of different scales and tests, and you can look all of these up and actually find out what those questions and criteria are. That's a journey for another webinar. But here we are. For the mental health, the SUM scale, after 12 months in the liposuction group, 44% of patients had improvements to their overall mental health versus only 23% in the conservative measurements group. This resulted in an overall statistically significant effort in favor of the liposuction. The physical SUM score, which has to do with your ability to do activities of daily living, said that after the 12-month mark, 73% of the patients in the liposuction arm had improvements in their abilities physically, whereas only 13% in the conservative measures group. And again, this was on parity across all stages. More stage data. Okay, that's just the synopsis. Now, one of the big questions that has been argued by the governments when people have applied for coverage is saying things like, well, we don't know if this is a safe surgery or if you go for this surgery and because they're taking high volumes, you know, we've heard some direct things about, oh, it's going to be so dangerous. And provinces have actually refused patients saying, we're sparing you from the dangers. Turns out, not true. Not true at all. The surgery is overall very safe. Now, I want you to remember that in any case, whether you're having your wisdom teeth removed or you're having a cardiac procedure, every time you undergo anesthesia, there is always a surgical risk, and the surgeon will explain those risks of any procedure to you. But in the liposuction criteria, we didn't really see risks that were above and beyond what you would expect, and there were no serious critical incidents. So in 410 patients of that, 278 were in the liposuction group. There were only a total of 21 events of any kind, and only 2 of them were severe enough to cause somebody to need to leave the study, period. The only major event that occurred actually happened in the group that didn't have surgery at all. Someone had a heart attack. So basically the things you'll expect to see will be the stuff we talk about in the groups all the time. There was 12 cases of anemia, which is that low hemoglobin, feeling like you're going to faint, maybe needs a blood transfusion, 11 cases of seromas, and then 3 cases of a blood clot. That was the most serious stuff that happened. And those are all expected potential outcomes. That's not a major outlier. Moving on. So what did we conclude? What did the Germans conclude? Based on the 12 months study data from LipLeg for the efficacy of all of the endpoints we just talked about, being pain, mobility, improvements to mental health, etc. All of those were taken into account, and there is significant effect in favor of the liposuction, which is very, very clear from the severity and consistency of this data across all stages. Taking this into account, the pronounced benefits, reduction of pain being the first and most primary goal, and improvements to quality of life, the efficacy of these results is considered high. We've been saying the words gold standard data. This is gold standard data. So there's the final results there. Okay. Now, this stuff is all going to be important for the Canadian context. And don't worry, I am going to make a document on this. And yes, it will be available on the website. We just need to sleep and eat for 5 minutes, but I got you. Okay. Medical necessity. In Canada, we have a rule according to the Canada Health Act that all treatment that is considered medically necessary must be covered under the public healthcare system as an insured benefit, unless it falls into those criteria of either emerging or experimental. That's the loophole the government's been using thus far to avoid making sure that we have access to healthcare, because they didn't have any proof that our surgeries were medically necessary, despite being told by our physicians and international surgeons. LipLeg identifies it clearly, and the German Federal Commission agrees. So, other things that came from this, lipedema is defined as a progressive condition. They specify that there's no very clear understanding of who's going to progress and who's not going to, and that's okay, but they do definitively state that it is progressive. Spontaneous healing of lipedema is not known. That means that we currently don't know of a cure, and we've never documented, according to this, seen somebody rid themselves or cure themselves of their lipedema. So based on the fact that this pathologically altered fat cells that we have from lipedema cannot be eliminated by any other form of conservative therapy. This means that the conservative therapy options that are currently available in the standard of care, please understand that in Germany, they do actually cover that for patients, including that and your MLD. So what the conservative therapies that's currently available in the standard of care, such as compression therapy and CPT, the decongestive therapies, they can only reduce symptoms. So conservative measurements only helps manage your symptoms. Here in clear and nice and gold, the only known therapy with the proven benefit profile that removes the fat cell tissues is currently the liposuction. End sentence. Given the medical relevance of the symptoms and the lack of effective or sustainable therapy alternatives to lipedema to date, liposuction is therefore medically necessary. I can't wait to have a shirt or a tattoo on my forehead that says that. So then they talk about things like necessity of hospital treatment versus inpatient, outpatient. This will be relevant to people like those who are in Ontario, where Ontario has a criteria that in order to receive medically necessary surgery, it has to be performed in a hospital. There is criteria in this and the guideline we're going to look at after, which talks about the necessity of the treatment to either occur in the hospital that is publicly funded or in a qualified surgical center where they have access to emergency measures such as intensive care or an immediate transfer for the patient. That's all going to be relevant to the Canadian context. Okay. Now, the other thing that we've heard often is, I've even heard a doctor, several, say this to me in my journey. They said, well, lipedema is going to bankrupt the healthcare system. Well, according to a public healthcare system as big as Germany's, there is no evidence to suggest that at all. There's no evidence that suggests that liposuction for lipedema is not cost effective. So that is also a reason why they're going to cover it under the public system. So the overall assessment, it was found that the benefits of liposuction for lipedema are sufficient to be proven that they are medically necessary, and the statement applies to all 3 stages. That's the big and important and monumental news. Due to the pronounced effects and high degree of certainty in these results, the Joint Federal Commission has concluded that they have the sufficient evidence, back to that first thing we talked about, is it insured, is it emerging, is it experimental? They have concluded they have sufficient evidence that is already available to assess these benefits, taking into account the lack of effective alternate treatments, has decided to include this method at this time. Okay, so those were the positive findings. Medically necessary, cost effective, and it is appropriate, is now considered an insured service. The next step for the German Federal Commission is that they have what I've been told is referred to as a rubber stamp process, where it just in October needs to go to their I'm losing the word. There's a committee just above this that just has to say, oh, okay. So effectively the people who decide costs and whatnot say, oh, okay. This evidence is strong. It is unlikely that the decision will be changed, is what I've been told by leads of the study. Okay. How are we doing for time? We're good still? I see Angel's face nodding.
Yep, doing pretty good.
Okay. I'm trying not to talk too fast, you guys. I really am. I promise that we do have information on this on the website, and will be available for questions. So the thing I have just pulled up is something I have been referencing to you guys in webinars and to the governments, which is this is what a guideline, a surgical guideline for lipedema would look like, it does look like. This is a series of very specific outlined policies about how do you make the diagnosis, who's allowed to make the diagnosis, who can perform the surgery, which patients are going to be eligible for the surgery, are there inclusion or exclusion criteria. This is the document beyond a standard of care that Canada has to make in order for us to be able to have surgery safely in Canada. All right, so they have made amendments to this, and it looks a little bit messy because what you'll notice is anything that's in blue that's been striked out, that was the old policy, and they're making amendments, and then they've added some other colors. So I know this is a lot of like visual noise. I'm going to just try to read through the important stuff and highlight it for you. Okay. So, like I mentioned, the job of this document is to determine the eligibility criteria and the absolute minimum criteria for who gets to implement the surgery, diagnose, et cetera, et cetera, et cetera.
Emma, could you blow this one up a little bit more? The font's a little
Yeah.
bit small. Thank
How's
you.
that? Perfect. Thank you, Raina. Okay, so the objectives here. The objective of this guideline is to ensure high quality care, which in Canada you are also absolutely have a right to, is the right care at the right time from the right places and the right people. So here we go. To ensure high quality care and safety of the patients undergoing liposuction. Surgical liposuction for lipedema should contribute to pain relief and eliminate any existing movement restrictions, thereby enabling an increase in physical activity. That's the goal. That's why we do surgery. We have lots of talks about what's the right method of surgery. Well, they answer that very, very clearly. Liposuction for the treatment of lipedema must be performed as tumescent liposuction. Dry suction methods are not permitted. Tumescent liposuction includes a lot of stuff. What it really means is it's the wet method. Doesn't specifically only mean water assisted, but when they add in the fluid before they remove the diseased fat. So dry methods are dangerous and they're not allowed for us. But they do list tumescent methods such as water jet or vibration cannulas. In the groups, we refer to those as PAL sometimes, power assisted, or TAL, T-A-L, tumescent assisted, which is kind of its overarching category. Okay. It also answers the question, which the government has had, about why aren't you just done in one surgery? Well, it states that liposuction may require several consecutive partial procedures, and that's for safety. A lot of us have way more than 5 liters, 10 liters, sometimes even more than 15 in a single surgery that needs to be removed. It's very important for the government to know when they're approving this that this is multi-stage so that you don't have to continue to apply and fight for your life every time you need another surgery. Okay. So diagnosis and examination prerequisites in order to be eligible. Okay. The method may be used. Basically, you have to have been diagnosed with lipedema by what's called the 4 eyes principle in Germany. This means it's two doctors who are independent of each other. One of them can be the treating surgeon, and the other can be any of the specialties that are listed below in this list. The reason for that is to prevent the bias of a surgeon just saying, oh yeah, this patient needs it, because then they would, obviously that's their job and they would get paid for that job. So this eliminates that and ensures that patients are accurately being diagnosed by 2 completely independent parties. When the government and doctors in Canada have said to us, there's no such thing as a lipedema specialist. That's not true. And here's the proof. Lipedema is diagnosed by a specialist. And specialists in Germany could include, and we have some of these here, an internal medicine doctor, physical and rehabilitation medicine, skin or sexually transmitted diseases. The translation to that would be dermatology, or OBGYNs, or doctors who can look after your sexual health. Or a specialist with training in phlebology. That would be people like vascular surgeons. Okay? All right. Here are the criteria that have to be met in order to be diagnosed with lipedema. We know that there's a big cascade of lipedema symptoms, but you have to meet these 3 in order to be classified as a lipedema patient. You must first have disproportionate, okay, symmetrical, meaning both sides of your body, increases to fatty tissue that only affect your extremities, meaning it spares your hands and feet. They will not classify for these purposes any treatment to the abdomen or any other areas, arms and legs only for Germany. You can't have any involvement of the hands and feet in order to have a classification of lipedema. Keep in mind, they acknowledge, and we do too, that you can have other diseases as well, including lymphedema, where you might have hand involvement. But to specifically receive the lipedema component of this diagnosis, no hands, no feet. And you must have pain or pressure on the soft tissue of the affected areas. It has to hurt. And that'll be based on a palpation, a big touch assessment from the doctor, as well as what you report. Okay. After the patient has been diagnosed, we're on to the purple now. After they've been diagnosed and liposuction is indicated, all of the following criteria have to be met. Now, some of them I have in green because they're good and they make sense. And some of them I have in red because they're a problem. So the first criteria is that you have to have had conservative therapy, so compression and MLD, for at least 6 months immediately prior to the indication for liposuction that has failed to resolve the symptoms of your pain and immobility. And that has to be well documented. You also need to be at a stable weight. You cannot have had any weight gain in the last 6 months. They don't qualify what this is, and I don't know about you, but I can't tell you a woman on the planet who hasn't gained a few pounds depending on their monthly cycle. So I would like to know what the specificity of that criteria is. More details needed, I think. And then here's where the real problem starts coming in. For reasons that don't make sense to us at Lipedema Canada, nor the doctors from Germany that we spoke to ask why did they decide this, they determined that liposuction for BMI, even though we know and the SK2 German guideline says that BMI doesn't mean anything for lipedema patients and it shouldn't be used at all, they have said that if you're between a BMI of 32 and 35, you're only permitted to have a liposuction if the excess weight you are carrying is presumed to be caused by the fat deposits of your lipedema on your legs and arms. And the way they'd figure this out is they only use waist to hip ratio in this case, which is where they measure and they're looking for small waist, big hips kind of thing. Here's the criteria for that based on your age, okay? So if you don't fall into this really strict guideline, they found a way not to cover you. But worse to that, they've said that if you're over a BMI of 35, you're not covered at all. This is wild. This is wild. And if you are above the BMI and waist to height limits, your obesity, they immediately assume you're obese. Obesity must first be treated until these limits are no longer exceeded, and you have to have met that criteria for a total of 6 months prior to being eligible to have liposuction. So I asked the German doctor, who I'm going to leave nameless because I don't want anyone to get in trouble. I asked why on earth would they do this? And he said, we cannot see a scientific reason, but we think that this is a cost-effective measure. They're trying to find a way to limit the number of people who can access life-sustaining medical treatment. And whatever's been written here could very likely happen in Canada. And so this is where the action part comes after, okay? So it is okay to be furious about this. We all are. I live currently in a body of a BMI 35, and I've had 9 lipedema surgeries, which saved my life, my mobility, and my career. I cannot imagine. I would never have attained that, ever, if this was the criteria. And I'm sure a lot of you are screaming at your screen right now saying the same thing. Okay, then a medical history should include any such psychological factors that may play a role in the clinical picture. When listening to the live adjudication of this decision, they justified this under making sure that people don't have things like an eating disorder where they are subject to maybe not be well controlled and somehow cause disease progression even if they receive their surgeries. That it was sort of unclear, and there was this air of fat phobia that ran through all of this section. And so again, I'm looking forward to having some more conversations and input from organizations like Obesity Canada and our obesity medicine physicians to speak to this. And also our resident mental health nurse, Raina from BC. This one had some eyebrows up. You guys can't see Raina, but she's got her eyebrows up right now. Okay. Quality assurance for the lipedema liposuction. This is really important. So they have approved it for in-hospital treatment and for lipedema patients on the outpatient basis, so long as the patient meets that criteria for their own safety, and that the outpatient facility is equipped with quality assurance measures like an emergency plan, access to an intensive care center, and they can transfer you. This does away with the notion that we should be traveling for lipedema surgeries and staying unsupervised in hotels. That's all I'm going to say on that. Okay, So another big one is that governments in Manitoba and in Canada have all given the argument in appeals that, well, anybody could perform lipedema liposuction. Like that's not special. Yes, it is. And here it is. This procedure shall only be performed by a plastic surgeon, a reconstructive surgeon, or an aesthetic surgeon, or other specialty, such as dermatology or venerology, so vein surgeons, vascular surgeons. But it's not enough to just be from those specialties. Before performing the procedure for the first time, the physician must be one of the following: have independently performed the liposuctions for lipedema in 50 or more cases. That would be considered a lipedema expert, a specialist. Or the performance of the lipedema liposuction in 20 or more cases within 2 years under the direct supervision of somebody who meets that first criteria. Now, when you ask yourself, does anyone in Canada have those criteria? No, they don't. Because they can't, because they couldn't have, because we don't have a standard of care, we don't have a policy like this, and we don't provide this treatment here. Do we have plastic surgeons in this country? Yes. Can we send them to Rome? Yes. If you're a plastic surgeon watching this, please send us an email immediately. We are actively seeking a surgeon to send to Rome for a fellowship opportunity to learn how to do this, and then also a fellowship in Germany to learn how to provide this care for Canadians. Moving on. So we talked about this before, but it's reiterated here. The maximum volume of fat that can be removed during any one session is 8 to 10% of the patient's body weight in liters. This next criteria is interesting, and it's important that we pay close attention to it under the premise that whatever happens here could very likely happen in Canada. No further liposuction may be performed in areas that have already been treated with liposuction. So for this reason, when the initial consult is made and the surgeon lays out their surgical plan of where they intend to treat you, it's very, very important that they have a clear understanding of, we're going to do this much on this one and this much on this leg, and then we're going to do this side of the body. Because if they understate the amount of surgeries, or if they inadequately treat you, then you wouldn't necessarily, according to Germany, Canada might choose differently. But according to this policy, you wouldn't then be able to go back and have that revised. So it's very, very important that you find a surgeon who does complete comprehensive assessments and care and makes a longitudinal care plan for you.
Hey,
All right.
just want to give you a 20-minute left in the webinar warning.
Thanks. Yeah, we pretty much nailed it. Hang on.
Perfect.
3 more points. We're winning. Like I mentioned, service provider has to make sure that they have access to emergency medical intensive care infrastructure. So we do have surgical centers in Canada, in every province in Canada, that are approved by our governments, and often our outpatient procedures are done there. So the who gets to go to which place is really going to be based, and it's listed in this guideline, and we have similar guidelines in Canada, based on who's an eligible safe candidate for an inpatient procedure versus an outpatient procedure. And it's really great that they've highlighted that both inpatient and outpatient are still to be covered under the public healthcare system. And then last, at the end of this, there's an appendices, which just really clearly outlines my favorite parts of this, which are who's qualified to do this. So that's our specialists in plastics, reconstructives, and aesthetics, or dermatology and venerology. And that specific criteria about who is an expert for lipedema surgery, independent in 50 cases or more, or has been supervised by an expert for 20 cases or more in the last 2 years. And that is that. That is the whole part of this. I'm going to turn this part off. How do I even stop sharing things now? Bam. Okay.
That is awesome. I just wanted to make a comment about the bankrupt, the system, because that comment has been made before, and I just wanted to talk about that a little bit. Emma, when we met with the Minister of Health in Manitoba, that was one of the things that we did talk about was the current cost on the healthcare system for lipedema patients. So this is more of an upstream treatment. We're saving, not that this is a concern because we deserve healthcare, But we're saving downstream like knee replacements, and we are a really healthy population otherwise. So if someone's losing their mobility early in life and maybe going into a long care treatment or under home care plan, all of those costs are going to go on, right? So this isn't just a new cost to the system. There's a lot of cost savings. And when you think about the number of employees in the public sector, which are really female, high percentages of female, like education, teachers, and in the healthcare sector, those employees are staying in the system longer, able to work longer, which is saving the burden on those systems, saving, workers' compensation or long-term disability costs. So there's a lot of savings to the system also for this.
Yeah, absolutely. I mean, and we're all worthy of healthcare. We've been screaming that forever. And the frustration to this point has been that every one of the criteria, these have been the excuses from the government. We don't know if the surgery is effective. We don't know if it's medically necessary. It's the same as cosmetic liposuction. Oh, we could do that here. Oh, you have to get a specialist to approve you or do it. Oh, we don't treat stage 3. None of this fits. And to be honest, we founded Lipedema Canada knowing this study was coming. There you go. You ever want to know how this organization came to be? Is because patients like us who were so deeply frustrated but terribly empowered said, absolutely not. We're going to do better. And so here we are at our year approximately 2, and now we're ready. And I'm really happy to be on this journey with you guys. Somebody asked a question before I start crying on the internet. Go.
Yeah,
Helen,
we'll
do you want to?
start off with
Yeah.
a French question, but I'll answer it in English first, and then we'll translate it in French. So, Elatar had asked about diagnosis in Ottawa, but this applies to everybody. First, we want to ask people to start off with their family doctor and talk about lipedema and bring them maybe a Lipedema Canada brochure so they have the information. And then if you feel like that's not going anywhere, some doctors have been very responsive. Like my doctor has been open to reading the material, so I know that I was comfortable with his diagnosis. But you can also research through the database that we have on our Lipedema Canada website. So there is a provider database that provides you details and contact information across Canada. So that would be your second step. But we always say start off with your doctor, because the more we talk about it to our doctors, the more this is going to be talked about within the medical community as well. So, juste pour répondre en français, pour ta question, où est-ce que vous pouvez être diagnostiqué? Nous, on suggère toujours de commencer avec votre docteur et peut-être amener aussi le pamphlet qui parle du lipoedème. Et si votre docteur n'est pas confortable avec l'information, vous pouvez aller sur la base de données que nous avons. Et sur le site web de Lipoedème Canada, nous avons une base de données de docteurs et vous pouvez rechercher pour un spécialiste dans votre région qui peut vous diagnostiquer. Alors ça, c'est pour Ottawa et n'importe quelle autre ville tout au long du Canada.
The only thing I would add to that is that when people write me on the website, I suggest as well reaching out to our community, because on our forum, not we don't know everybody's experience with their own family doctors, who they're getting recommended to as well, and we're just building our database. So it's because of course we have people across Canada. On our Facebook group, we suggest you go there and pose a question, because maybe there's somebody in your area that can advise that they got a diagnosis somewhere. So that's also a very good forum to get into.
And it doesn't have to be a family doctor. So I think my runner-up was my manual lymphatic drainage specialist, my massage therapist. So that's why we're saying it does double check with the database and the community, because they may be able to refer you to somebody who really knows lipedema best.
Mm-hmm.
A couple of questions that I spotted here. I just meant to give you guys those action items before we get into the last of the questions, just so we make sure we do that. So first off, if you have a plastic surgeon that you know personally who has hospital privileges and you think would be an ally to the lipedema community who is Canadian, please send us an email or send that surgeon to us directly at info@lipedemacanada.org. We have the funding, thanks to our sponsor, for one surgeon to be paid to go. We actually have a very large amount of attendance of Canadian doctors and nurses and even patients who have already registered and are coming to Rome. Canada will have a very strong presence at the World Lipedema Congress this year, but we still need to find a surgeon who is available and willing to go and take advantage of this opportunity, as it is a likelihood that Canada is going to need to start paying that surgeon very soon for this procedure. So governments, if you're listening, please give us a message and a call. We would love to collaborate with you to send more than one provider. But we're doing everything we can. As I think the government told me once, you should just fund this yourself.
Emma, let's do a shout out to, you mentioned our sponsor, but the sponsor is, who is helping us with this.
Absolutely. That is thanks to Bauerfeind Curaflow Canada. They have been an ally to us since the beginning. They provide us with our compression garments, and they just dropped some beautiful new colors. That's irrelevant, but really cute. It was their ads are great. But they have legitimately, this is not sponsor talk. You guys, these are people who came to us when Lipedema Canada was an infant and said, we can see how hard your community is struggling. We just want to help. And we said, okay. And we've been figuring out how can they help this whole time. And when I explained to them what was happening with why we can't get diagnosed and we can't get treatment, they worked it out with us that they are going to sponsor a surgeon. And that's incredible. Like, I don't have words.
Love them.
For that. It's incredible. So really amazing. The calls to action we need from you. I know that there has been a long period of time where we're like, can you volunteer? Can you help us? Can you do something? Now we have tangible, actionable things you can do tonight. On the website, lipedemacanada.org or lipedemacanada.org/FR for French. We have a new page up called LipLeg. And when you go to the LipLeg page, at the bottom of that page, all of the calls to action are there. We want you to go and download one of the templates we have made for every province in Canada in both English and French, and one to the federal government. Those letters go to your health minister, and they basically explain this whole situation to them and demand access and agency and change right now. That's an editable template. Feel free to add whatever you want to it. We just wanted to give you the information as a starting point. Go download that immediately after this and send it. You can email your health ministers. You can also put them in the snail mail. You can stand outside their office if you want. Either way, get those letters to them, as many as you can, as fast as you can. Next, we have made the very first Lipedema Canada change.org petition with an action item to every health minister in the country, including the federal minister for Health Canada. So at the government, the top. Now remember, provinces are in charge of healthcare, so we have to speak in a variety of ways. Okay, we can't just yell on the internet. We have to actually action this. Go and sign the change.org petition and start sharing it wildly. The more we can prove how many Canadians are really involved in this, we have strength in numbers. We are powerful as a group. So go get to work, start writing on that. And then if you have the ability to, please donate to Lipedema Canada. I hope the last thing we told you about sending surgeons to Rome helps you understand what we are doing for this community. And we cannot do this alone. We are volunteers. We run a not-for-profit. If you can donate $10, anything, I promise you we're going to put it to good work immediately. So the last one that's on there is if you want to register for Rome. I put the link there as well. Okay, so that's your four.
I want to jump in, Emma. I know you said sign. I'm not sure if I heard you say about sharing it. So if you didn't, I want to say just you don't have to have Lipedema to sign this petition. We want all the support. So send it to everybody you know to sign.
Yeah, the link to LipLeg. Okay, someone else go for a question. I'll grab the link to LipLeg for these folks. And
Okay.
So we have a question.
Go for it.
Oh, go ahead, Holly. Sorry.
Yeah, so I just mentioned, I put a running list of the questions. So the next one after the French one was, did the German study cover if lipedema recidivate after the surgery? If yes, how many months, years? Did we follow up with patients after the surgery to measure if it recurred?
Yeah, great question. So there are some studies that looked at that. Now, keep in mind, this study has only got 12 months results out. But there are studies that exist, which are not randomized control, that looked at lipedema surgery, regrowth, and efficacy 4, 8, 10, and now 12 years out. And the results at 12 years out for over 80% of patients is still positive. So there will always be some people who do have regrowth. That can be for different reasons. It can be because maybe you weren't fully treated. It could be that you went through a big hormonal event or a trauma or a stress. There's lots of reasons our bodies can change. But as a general rule, overall, once you are properly treated, 80% of us will experience positive benefits to our life 12 years later still. I don't know about you, but there's a lot of conditions in the world where they will offer treatment and you may only get 6 months of benefit.
Okay.
12 years.
We're going to keep them fast and short here. The next one was, if there are no specialists in Canada because they don't teach it at this time in the schools, who will be available to perform the surgeries? And I think you covered most of that, but you can reiterate.
The reiteration is that currently the provinces are going to be required then to send you internationally. If they don't have care in Canada, the first thing they'll do is look to other provinces where there might be a doctor that can do this. We've definitively got the concrete evidence that there is nobody qualified at this moment in Canada. We do want to fix that. We don't have it. They have to send you internationally to a qualified expert who meets these criteria.
And that kind of dovetails into this next one because it's very specific about a specific surgeon. I've been told that there's a doctor in Calgary that performs liposuction surgery for lipedema. Do you know this doctor? So you can address that.
Yeah, we do. We know who these doctors are. All of them are Canadian plastic surgeons who are qualified to be Canadian plastic surgeons. None of them meet the criteria of having done 50 independent lipedema reduction surgeries and sentence. It can't have happened here. And if for some reason somebody did meet that criteria, let's say they were trained abroad, let's say that German surgeon came here, immigrated, said, I'm here, I'll save you. We still do not have safety policies. We don't have a Canadian standard of care. We don't have a Canadian surgical guideline, and we don't allow a liter limit above the cosmetic liposuction of 5 liters. So what we're saying is, even there isn't a way to safely have this surgery here. And then who's looking after you afterward? Nurses who've never heard of it? Physiotherapists who don't know anything about it? Surgery is more than what happens in the OR, you guys. So there is cosmetic liposuction available in Canada, and some of those doctors will even write that they treat lipedema on their websites.
And can I just, because a bunch of us here have had surgery, I just came back from surgery, and I can personally attest that as Emma mentioned, these specialists that we're going to away, because they are specialists, because they are doing this every day, they see the things that can go wrong. And me personally, I had lipomas removed from my ankles. A lot of times, a lot of surgeons don't do this, but they had grown around my nerves there. So this surgeon knew how to deal with this. These are Emma's had many complications, comorbidity complications and things. You were scared to death going in because you
Yep.
wanted to make sure somebody knew how to deal with these things.
Yep. Somebody else is asking about HRT and as a catalyst for growth. We, on our YouTube channel, which is Lipedema Canada, so Lipedema_Canada, you could find it on our website too. We did a great webinar with Dr. Celia Egan on lipedema and menopause, and it turns out HRT is actually really good for us for lipedema. I would never have guessed that. Go watch that. It'll answer all your questions. I promise. Keep going. What else we got?
That's it so far. That's what we got here. Unless anybody else has more questions in the chat, we're 5 minutes out from our time. So fire away if anybody has anything else.
Have we been scanning them?
Yeah, we scanned them. So there's the last one from Doris.
Emma,
What needs to get done?
Sorry. I did put the LipLeg link in there, but I can't do it to everybody. Can you just repost that link?
Oh yeah, sure. I got you. Hang on.
Yeah.
Ooh. Copy. Oh God, it just took me. I'm in.
So Amanda, to answer your question about some private insurance companies claim to pay out of country procedures if they're approved by our healthcare and are not experimental. So this is a very case-by-case basis. The amount of clients or insurance policies that cover out of country are very, very small. And most of the time they won't cover, I don't know if they consider it experimental, but things that they are not recognized in this medical system. So you'd have to be very specific. And I don't think we're there yet with the insurance companies. We're not even close to that. Yeah.
Can I tag in on that and just add a little bit more
Yeah.
detail? So a lot of those insurance companies, Blue Cross, Green Shield, the ones that have the policy about, oh, we'll cover your surgery out of the country, they use the fact that the provinces don't cover it as an exclusion criteria. It's the same reason why some of them say they'll cover things like GLP-1 medications, but then if the province won't cover you, they don't cover it. So it really depends on your insurance plan. We have heard of the very occasional person who's been managed to get their private insurance to pay some portion of something. But like a lot of systemic failures in this issue is that even if you have coverage, including folks in Nova Scotia we know of that had who are Indigenous First Nations, their First Nation was 100% willing to pay for their surgery, but they weren't allowed to access it because the government wouldn't make a decision on whether or not they were allowed to have the surgery or not. So there are failures in every section, which is why we have to send those letters. The link is now in your chat. I hope everyone has it open on your phone and then your computer. You're ready to go and act. I want you to break the website tonight. I want you to go there so fast.
No, don't break it.
Don't break it. It's hard.
Don't break it.
But
Can
I
I
don't think
comment on Kathy's note about disappointed about some of the information you're receiving from various professionals? Because I want to end off with tomorrow, we're going to appear on CBC's The National. So Lipedema Canada is going to be featured on The National tomorrow. So tune in wherever you're from. It's 9 p.m. Eastern Standard Time. But they asked me that question specifically, so I was featured on that interview. And as disappointed as it is, I think it's sad. And I don't necessarily blame all the professionals because there's some professionals, as soon as they figure out or they hear more information about lipedema, they're like, wow, I need to learn more. And I think Emma has experienced this as well with our recent work with Obesity Canada. There are so many professionals that are willing to help. And I know, as disappointing as it is still hopeful that this is a word that is more commonly used now than it was 10 years ago. And I think that's what we need to focus on, getting that word out there and more people recognizing it.
Absolutely. You know, the
that
thing
there-
German researchers, sorry, Holly.
So no, I just don't want to run out of time. So I just want to, on top of that, there was that question you mentioned it from Doris, that what needs to be done to get training for family doctors in lipedema. They're the gatekeepers. What do you say to Emma?
Actively, we are working to try and get lipedema included into Canadian medical schools, and doctors who are interested reach out to us every day. I offer lunch and learns where I have presented just in June during Lipedema Awareness Month to over 2,000 Canadian clinicians, giving them the webinar on how to diagnose lipedema and how to better understand it. And we're continuing to do that. I'm collaborating with physicians all the time. If you want your family physician to be involved, just let them know. All they have to do is send us an email, and we'll include them. We will help train them. So we're doing everything we can, but how do you fix a system that is irreparably broken at the moment? We one day at a time.
That was a very nice. Stacy says, I
Stacey.
went to get a vascular studies recently and asked the tech if she knew about lipedema. She literally just got off a webinar that you hosted.
I love you. I want to highlight what the leads of the study told me was the most important and most positive thing. They said, we acknowledge that this isn't a perfect answer, but the change and progress is obviously not always linear. But what has happened in Germany as of last week is a place they can't go back from. That is our stronghold. We don't move backwards from this kind of evidence. We only move forwards. The issues with the BMI are huge, and we are going to speak about it publicly and issue public statements about it. And we invite your voices on that. But let's not lose sight of what has been achieved. Somebody put 5 years of research and millions of dollars into our condition and came back with the answers that, instead of us screaming into the void, they're standing there and saying they were right the whole time. And that is really validating. So know that this will affect policy change. We already have some meetings going forward with health ministers. And when you start sending those letters, I promise you they're going to reach out to us.
And keep on signing the petition. Send it to all your friends.
Yes, for sure. And if you appreciate the work, there's a lot of people that are giving kudos to Lipedema Canada for the work that we're doing. If you can donate, please do so. We are currently, we've applied for grants now that we have charitable status, but haven't been successful in the one grant that we heard back from. You know, we rely on our sponsorships, like Bauer Find and Life Pro, and then donations from the community. And just when you think about how much money we spend just on sending out brochures across the country on a weekly basis, that alone needs quite a bit of donations just to support that. Yeah, and we really appreciate our community for showing up.
Yeah. Thank you guys so much for joining us on this webinar, and let us know what else you need to hear. Send us an email, comment it on our Facebook. When this recording is done, I will get it up to our YouTube so we can enrage people who didn't watch it, who are from the government. Sorry, love you, please call us. We need to talk.
And watch us on CBC The National.
Oh yeah, share that everywhere. Okay, love. Thanks to my whole committed board who has been working on this nonstop through what was supposed to be a week of summer vacation for us all. I really appreciate these folks, and 5 volunteers with Lipedema is what runs Lipedema Canada at the top, and then all of you. So we love you, Lipedema Canada. Thanks you, and good night.